My name is Karen, and today I'm going to be discussing what acute renal failure is. What is renal failure? Renal failure is when the kidneys are unable to function as they normally would. There are two different types of renal failure. There's acute renal failure, which happens unexpectedly and it can be reversed. And then there's chronic renal failure, which is a very slow process that can take months to years, and it can lead to permanent kidney failure. This is also known as end-stage renal disease. Etiology. There's different ways that acute renal failure can happen. There can be damage from muscles because of dehydration, infection. If you have less blood flow to the kidneys due to blood loss or a blockage, if you have certain medicines can ruin your kidneys. Then there's inflammation to the nephrons, which also nephrons filter the blood, and so if you're unable to filter the blood, then there's kidney damage there. And then if you have anything that stops the flow of oxygen for the kidneys, that too can cause kidney damage. Demographics. It is very common in more than 200,000 US cases per year. It is most common in individuals between the ages of 41 to over 60. It happens often when you're in the hospitals because your immune system's already down, and so it can lead to kidney damage because when you're in the hospitals, you're usually there because you're sick, such as heart attack, stroke, different bacteria, viruses. And individuals with diabetes are also more likely to have acute renal failure. Here's two little graphs that I found. The first graph is for hospital stays. The little green line is for individuals who came to the hospital because of acute renal failure. And the blue line is for individuals who were in the hospital and then they got diagnosed with acute renal failure. As you can see, it is much more common to develop it while at the hospital than while at home. And the second graph is individuals who have diabetes. As you can see, it is more common in men with diabetes than in women, but it is less common in individuals without diabetes. So the anatomy. Kidneys filter the blood. Their main job is to clean the body. So anything that needs to be removed through your urine, it maintains all the balances for your body to function properly. Common symptoms of acute renal disease are fever, weakness, fatigue, rashes, diarrhea, poor appetite, vomiting, abdominal pain, back pain, muscle cramps, no urine or high urine output, pale skin, nosebleeds, and inflammation of the eye. There's a lot of symptoms, and that's because the kidneys are so very important in regulating all of the chemicals and molecules inside of the body. And this just like a little image. Physiology. So this picture, it starts off showing how things that can go wrong in the body can affect your kidneys, and then that can affect other parts of the body. So on the top it says low cardiac output can lead to acute kidney injury, also acute kidney failure, and that can lead to congestive heart failure. And so, as you can see, just small changes in the body can affect so much in the rest of the body. It's very important for the body to maintain homeostasis. Diagnosis and treatment. There's blood tests, urine tests, a renal ultrasound, kidney biopsy, and a CT scan. And of course, I'm sure the doctors are going to ask about your medical history, family history. Treatments depend on symptoms, age, and overall health. One of the main things they're going to do, if you're dehydrated, if you've had blood loss, they're just going to put fluids back into you. Or if you need to increase your urine output because you have too much, they're going to give you diuretics. They're going to watch your electrolytes because, like I said, those are very important in your body when it comes to everything. Medicines to control your blood pressure. If you need special dietary needs, you can't eat bananas usually because of the potassium. You have to watch your liquid intake. You need to watch your salt intake. Dialysis may be needed, and if necessary, a kidney transplant. Dialysis involves removing the waste, substances, and fluid from the body that your kidneys normally do. And so because the kidney function is lessened, your body cannot do that as well. There's two types of dialysis. There's one that involves a catheter being put into your peritoneum, and that is how it's drained and cleaned. And the other one requires a surgery where they put something inside of your arm so that you can be hooked up to a machine, and that machine removes the blood, filters it through the machine, and then puts the blood back inside of you. My dad was actually on this machine. Artificial intelligence. So advancement in science has made it possible to predict acute renal failure. Unfortunately, at this time, it is not reliable, and a lot more studies need to be done. And then I just have an image of how the artificial intelligence would work. It basically would monitor your fluid output and just if you have anemia and the chemicals and molecules inside of your body. Eventually, hopefully. And then here's my references.